Hello, this is Kelly Migler, and this is my presentation on my proposed course unit titled Culturally Competent Care in Healthcare. An introduction is that why is a course in culturally competent care needed in education, in healthcare education? The U.S. Census Bureau in 2019 identified that the U.S. population is becoming more diverse. We have individuals from a variety of cultural, religious, and lifestyle backgrounds. Also, it was identified that the underage population has become more equal, related to the number of individuals in a white non-Hispanic background and those from a variety of backgrounds. So as this younger population ages, we are going to have even a more diverse population of patients in the healthcare system. It is important that cultural and linguistic competency is practiced within the healthcare settings to meet the needs of our diverse population. And this just means that it is the capacity for individuals and organizations to work and communicate effectively in cross-cultural situations. So it is important that everyone within an organization is aware of individuals' cultures, how that might impact their healthcare or their health outcomes, and that organizations present a culture of recognizing culturally competent care and providing health care to individuals within the context of their culture. And so Jeffries and Zucca in 2018 identified that culturally competent care can actually improve health outcomes. It was noted that providing care without the consideration of a person's culture can actually create health disparities and poor health outcomes. So it's important that healthcare is provided within the context of our patient's culture. It was also a needs assessment that was performed that identified a gap in cultural education experiences in the undergraduate healthcare professions programs in which I teach. Culture used to be addressed and taught in an undergraduate nursing course that all nursing students had to take. Recently, about a year ago, there was a revision of that course into an interprofessional education course called Social Determinants of Health. And when I reviewed the new course, the new interprofessional education course, I noticed that the cultural component that was included previously in the nursing course was removed. And there now appears to be a gap in the curriculum related to cultural education. And so that is why this course has been proposed, to add that content back into the curriculum. And so the course will be titled, as mentioned before, Culturally Competent Care in Healthcare. It will be an interprofessional education course in that it will be embedded in. It will not be a complete course. It will be a course unit that will be added to the Social Determinants of Health course in the interprofessional education course. Students who are enrolled in the Social Determinants of Health course are sophomore level students, and all students in all of the programs in the College of Nursing and Health Professions are required to take this course. So students in this course will be nursing, healthcare leadership, public health, and our health science students who are undergraduate physician assistant students who will then move into our PA graduate program. The unit will be taught within 1 week during this course, with 3 class meetings on a Monday, Wednesday, Friday, and each class period is 50 minutes. The theoretical framework that has been used for this course is Jeffrey's Cultural Competence and Confidence Model. The Cultural Competence and Confidence Model is based on transcultural self-efficacy and the 3 learning domains of cognitive, affective, and practical. Jeffries recognizes that cultural confidence is an ongoing process. No one ever reaches the goal of being a master of cultural competence because it is unrealistic to think that we know everything about all different cultures, religions, lifestyles that create a diversity in individuals. So it's always an ongoing learning process. Transcultural skills are those skills that allow us to be culturally aware, recognize individuals' diversity, and implement care within the context of their culture. So effective teaching of cultural competence should provide a presentation of diversity and cultural information, an opportunity to discuss feelings about diversity and cultural awareness, and the opportunity to practice culturally competent care. And this addresses Jeffrey's theory that culturally competent care education needs to address the 3 domains of learning. Healthcare workers who attended a culturally competent care training that only included a presentation of information stated that they did not feel confident including diversity and culture into a patient's care. This was identified by Jeffrey, and so this has led to the inclusion of practical and affective domains of learning, in which students should be provided a platform or activity in which feelings about cultural competence and skills to implement culturally competent care are provided. The course objectives, you can see there are 4 of them, and they address the 3 domains of learning. The cognitive domains are addressed by objectives 1 and 2, define culturally competent care and identify cultural factors that impact care. The affective domain of learning is addressed by the 3rd objective, which is to discuss how cultural beliefs shape patients' interpretations and experience of disease and treatments. And the 4th objective will address the practical domain of learning, in which students will be expected to implement a cultural assessment. Student motivation is very important during any learning experience. Students who are not motivated will not engage in the learning experience. So Brookfield has identified the importance of creating a positive learning experience. And a positive learning experience begins with the educator's presence in the classroom. The manner in which an educator presents content can motivate the student's engagement in the learning experience. Faculty also need to act as a role model and portray enthusiasm and expertise of the content described by Brookfield. As the faculty teaching this course unit, it will be necessary for me to become knowledgeable about culture and diversity, and I would engage in some continuing education programs in order to learn more about culturally competent care before teaching it. It's also important that I present the content that emphasizes the importance of the content and how it will relate to the student's clinical practice. Students tend to become more engaged and motivated if they know why this information is important to them. And so I need to portray that to the students. Also, the use of active teaching strategies implemented during the course unit will help motivate and engage students in the learning experience. The traditional teaching strategies that will be used are lecture. Lecture will be used to begin the course unit and introduce students to the concepts of culturally competent care. It will also be used to motivate students' interest. Discussion will then be used. Discussion allows students an opportunity to apply concepts, clarify concepts, and evaluate their own beliefs and attitudes. After the lecture of culturally competent care, students will use the discussion in groups to clarify information and explore their feelings and attitudes towards culture and healthcare using a prompt question. Following that, students will view a YouTube video that will show a demonstration of how a cultural assessment is performed. This video will allow students to see the concepts of culturally competent care applied in the clinical setting. Viewing the video will help reinforce concepts and may also lead to further discussion about implementing a cultural assessment and providing culturally competent care. Activity-based strategies that will be used are a case study. A case study can be used to present real-life patient care that allows the students to critically think and problem solve. This will be a group activity performed during class. Each case study will present a patient with a different cultural, religious, or lifestyle background. Students will be required to work through the case study and identify what culture and religious or lifestyle information is relevant to the patient's care and how that can be incorporated into the patient's care. Students will then participate in a simulation experience in which they will perform a cultural assessment. The simulation experience will allow students to practice communication skills and assessment of culture with a patient from a diverse background. And this will be important because simulation will provide a safe learning environment in which students can practice this without fear of harming or saying the wrong thing that might offend the patient. Computer-assisted technology or strategies. I have not developed any other technology-based strategies besides the use of simulation, which provides a controlled real-life representation of patient care that will use high-fidelity simulators in which the faculty can communicate with the students as the patient and answer questions so that students can practice their communication skills during the simulation experience. As this course unit is only 1 week long, I did not want to overload the unit with too many activities and then have the students feel overwhelmed. Assessment and evaluation will be an ongoing process throughout the course unit. Cognitive domain will be assessed with test items during a test that the lead faculty will administer following the course unit within the course. The discussion activity will assess students' cognitive and affective domains, as it will allow the faculty to observe students' responses to the question prompt. And the case study will allow the faculty to assess students' cognitive, practical, and affective domains as they work through a real-life patient scenario with a patient from a different cultural, religious, or lifestyle background. And then, of course, simulation will allow the faculty to observe the students' practical skills while implementing a cultural assessment, and debriefing following the simulation experience will allow students to reflect upon their attitudes and beliefs towards culturally competent care. And so these are my references, and I appreciate your time.